Mosquitoes are common insects found all over the world. They are known for their blood-sucking behavior, which is essential for their reproduction. Female mosquitoes need blood to produce eggs, and they will bite humans and animals to obtain it. Mosquitoes use their proboscis, a long, thin mouthpart, to pierce the skin and draw blood. The proboscis contains 6 needle-like stylets that work together to create a small wound and extract blood. As the mosquito draws blood, it also injects saliva into the wound. This saliva contains anticoagulants that prevent the blood from clotting, allowing the mosquito to feed for longer. The saliva also contains proteins that can trigger an immune response in humans and animals. This response can cause itching, swelling, and redness around the bite. In some cases, mosquito bites can also transmit diseases such as malaria, dengue, and Zika virus. The mosquito's proboscis is a complex and fascinating mouthpart that allows the mosquito to pierce the skin and draw blood. It is made up of 6 needle-like stylets that work together to create a small wound and extract blood. The stylets are enclosed in a protective sheath, and when the mosquito is not feeding, the sheath covers the stylets and protects them from damage. When the mosquito is ready to feed, it extends the stylets and inserts them into the skin. The stylets are very sharp and can easily penetrate the skin. Once the stylets are inserted, the mosquito begins to pump saliva into the wound. This saliva contains anticoagulants that prevent the blood from clotting, allowing the mosquito to feed for longer. The saliva also contains proteins that can trigger an immune response in humans and animals. This response can cause itching, swelling, and redness around the bite. Once the mosquito's proboscis has pierced the skin, it begins to draw blood. The mosquito saliva contains anticoagulants that prevent the blood from clotting, allowing the mosquito to feed for longer. These anticoagulants work by interfering with the blood's clotting process. They do this by binding to the proteins in the blood that are responsible for clotting. This prevents the proteins from forming the clots that would normally stop the bleeding. As a result of the anticoagulants in the mosquito saliva, the blood continues to flow freely from the wound. This allows the mosquito to feed for as long as it needs to in order to obtain a blood meal. Once the mosquito has finished feeding, it will withdraw its proboscis and the wound will begin to heal. The anticoagulants in the mosquito saliva will eventually wear off, and the blood will clot and stop flowing. When a mosquito bites you, its saliva triggers an immune response in your body. This response is designed to protect you from infection and to help the wound heal. The immune response begins when the proteins in the mosquito saliva bind to receptors on the surface of your immune cells. This binding triggers the release of histamine and other inflammatory mediators. Histamine is responsible for the itching, swelling, and redness that are associated with mosquito bites. It causes the blood vessels to dilate and leak fluid, which leads to inflammation. The immune response also includes the production of antibodies. Antibodies are proteins that bind to specific antigens, which are foreign substances that trigger an immune response. In the case of mosquito bites, the antibodies bind to the proteins in the mosquito saliva. The antibodies help to neutralize the mosquito saliva and prevent it from causing further damage. They also help to clear the infection and promote healing. Mosquitoes can transmit a variety of diseases through their bites. These diseases include malaria, dengue, and Zika virus. Malaria is a parasitic disease that is transmitted by the Anopheles mosquito. The parasite enters the human body through the mosquito's bite and infects red blood cells. Malaria can cause symptoms such as fever, chills, sweating, headache, and muscle pain. In severe cases, malaria can be fatal. Dengue is a viral disease that is transmitted by the Aedes mosquito. Dengue can cause symptoms such as fever, headache, muscle pain, joint pain, and nausea. In severe cases, dengue can lead to hemorrhagic fever and shock syndrome, which can be fatal. Zika virus is a viral disease that is transmitted by the Aedes mosquito. Zika virus can cause symptoms such as fever, headache, muscle pain, joint pain, and rash. In severe cases, Zika virus can cause birth defects in babies born to infected mothers. Mosquito-borne diseases are a major public health problem around the world. It is important to take steps to prevent mosquito bites, such as using insect repellent, wearing long sleeves and pants, and staying indoors during peak mosquito hours. There are a number of things you can do to prevent mosquito bites, including using insect repellent. Insect repellent containing DEET, picaridin, or IR3535 is effective at repelling mosquitoes. Wearing long sleeves and pants. This will help to create a barrier between your skin and mosquitoes. Staying indoors during peak mosquito hours. Mosquitoes are most active at dawn and dusk. Using mosquito nets. Mosquito nets can be used to keep mosquitoes out of your sleeping area. Eliminating mosquito breeding grounds. Mosquitoes breed in standing water, so it is important to eliminate any sources of standing water around your home. If you do get bitten by a mosquito, there are a number of things you can do to treat the symptoms, including washing the bite with soap and water. This will help to remove any bacteria or other irritants from the bite. Applying a cold compress. This will help to reduce swelling and itching. Taking an over-the-counter antihistamine. This will help to reduce itching and swelling. Using calamine lotion. Calamine lotion can help to soothe itching and inflammation.